Hi, my name is Juan, and welcome to The Couch, a podcast where real therapists talk about real things. Please remember that we are therapists, but we are not your therapists, and this podcast is intended for educational purposes only. So I think this is a really good episode for parents that are either thinking about having their child start counseling, or you're already in the process, whether you're working with a counselor over at our practice here at Santos Counseling, or someone in your local area. I wanted to give you this space here as parents. Myself being as parent, I think sometimes when we take our kids to counseling, it can be an unknown or a bit of a challenge to really understand, how do I support, how do I help my kids with therapy, right? Because you're probably thinking, which is one of the most common questions that I get, is how much do I ask, right? And I often get that if I'm working with a minor. I may have a parent, and the parent may say, Juan or Dr. Santos, how much do I ask here, right? Because I want my child to feel comfortable, to feel safe, but I don't want to jump in all their privacy and all of that. So maybe that's where we start, right? So it's a great place to start when we look at how to support your child. And again, this series right here on the podcast, we are focusing on, and you'll notice on the title, parenting tips. So we're looking at how to help your child during therapy, because there's a lot you can do right, and there's a lot you can do that's not so right, so wrong, while your child is seeking therapy. Let's start with what I mentioned earlier, which is respecting your child's privacy, respecting your child's freedom. So in our state of North Carolina, you could look this up, but overall the rule is if the individual is a minor, then the parent has access to the areas of confidentiality. Now, as a clinician, what I encourage parents to consider is, let's not create therapy as a space where your child's going to get in trouble, right? Meaning that your child goes to therapy and they feel that if they tell you something, you're gonna they're gonna tell the parent. Now, of course, remember there are ethics here, so there are certain things that if they do come up, such as harm and so forth, if they come up during counseling, there's ethical rules that we as clinicians do have to follow. I'm talking more about just the day-to-day, right? So it could be if you're, let's say if I'm working with a teen, the teen's dating, but the teen goes, hey, I'm thinking about dating this person, but don't tell my parents about this, right? I want to think about what's the risk in there, because if I go to the parents and say, yeah, you should know your child's thinking about dating a blank person in their class, and the parent comes in to the child at some point and says, why did you tell your counselor? Why didn't you tell me? Right? I'm curious as a counselor, how is that going to impact privacy? Right? Is that teen going to come back and feel comfortable in the setting, or are they going to feel that, maybe I don't want to say too much in here? Now, most clinicians that you'll work with, and we do this here at the practice, there's always going to be that dry conversation, right? Initially, when you start counseling, there's the dry conversation of confidentiality, privacy. When we have to breach confidentiality means when we have to talk to somebody out, like a third party outside of the session. And most individuals coming into therapy are educated on that. What I want to share here, as far as a parent, when you're looking at my child's in therapy, how do I help them? That's keeping that line open meaning that your child knows your child is Sarah. Sarah's going to go see her counselor, and Sarah gets to talk to her counselor about X, Y, or Z. You may have an idea of, like, here's the goals, here's the big picture things that they're working on. But I would encourage that when you do approach your child, approach from a position of curiosity, understanding versus judgment or prying. Really stay away from being a detective. Those detectives in those crime shows, or an attorney of, tell me blah, blah, blah. Really stay away from that. Instead, I encourage you to open up the door. So I'm going to give you an example here so that it makes sense and you can play with it with your child. Let's say your child's seeing a therapist. Maybe during the car ride, you can say, hey, I really hope you had a really good session today. I know that when I see my counselor, sometimes I feel really, motivated. Other times we talk about really deep stuff, and I'm like, oh, I need a nap. Overall, just hope you had a good session. What that does is it allows our child to know that therapy is for everyone, right? Therapy is not a space where something is wrong with you. Like, why is this person in therapy? Therapy is not that space. So that's something that's really important to kind of clear out, and it helps with that communication. The other item here to look at is, let me pull it up in front of me. I've got my PDF here as a side note. Allow your child to know that it can be a back and forth. Sometimes parents skip that, and kids aren't aware of that. Sometimes kids come to therapy and they'll share with me, can I talk to my parents about this? Right, which is such an interesting question. I'm like, yes, you can talk to your parents about this. Of course, open up that communication. But they may not know that, right? Maybe the child, Sarah, goes to therapy because she's struggling with depression or body image or anxiety or academic performance. And Sarah is thinking that she can only come in and talk to the therapy about the therapy stuff. So then she doesn't go home and talk to everybody else. And really, it could be the opposite of that, where she can, have more dialogue on those topics. The other item here that I want to touch on is when looking at how do I help my child with therapy. Number 2, get to know what the treatment is. And the treatment is, look at it in a physical way. If your child has an injury on their leg and they go to see a physical therapist, and the physical therapist says, let's talk about treatment. The treatment is that we're going to work on slow walking, some stretches 4 times a week, and a jog on Saturday. Cool. I know the treatment approach, the plan, got it. So now I can help my child. When your child is working with a counselor, try to create space for that conversation to get an idea. It may not mean that you get every single tiny detail, but instead you're getting the big picture, right? The treatment could be that your child's going to counseling to work on, let's say, self-esteem, to work on self-confidence, right? You knowing that as a parent, that's gold. Because if you know that your child is going to counseling to work on perhaps self-esteem or self-confidence, it's gold, because then from there you can work with the counselor and say, hey, counselor, I know that you're working on self-esteem, self-confidence. What can I do as a parent to implement those things at home, right? And then you could start implementing little exercises at home. And what happens is your child's got this 50, 60-minute time that they're working on those exercises with their counselor, and they get to go home and do a little bit more, right? So that's I think that mythology, it just really goes a long way. Next item here, when we look at how do I help my child with counseling? Be patient. Be patient. It's not a marathon, it's an ultra marathon. And if there's one that's longer than an ultra marathon, it's that. Be patient. And then you know what I want you to do as a parent during this time of being patient? I want you to dance. I want you to just get excited when there are moments to celebrate, when there are things that are going well. Not only, don't solely wait until that last session when things end. Celebrate the process along the way. And it could be that your child goes through their first session, and then in the car you go, hey, listen, you don't have to say anything. I am so proud of you for going in there. I wish at your age I did something like that. I think you're strong. I'm proud of you. I don't know what you talked about in there, and I want to know. And if you're open to it, let's talk about it. But I am just so proud of you. Give me a quick second. Let me clear my throat. Alrighty. The next one I want you to look at here is, how do I help my child while they're in therapy? Well, I think it's helpful to build competence, build education, understanding, knowledge. Try to understand, what is your child going to therapy for? So earlier I mentioned the example of self-confidence, self-esteem. That means that if my child is going to counseling to support them with maybe self-esteem, I want to go home and educate myself. I may even go seek my own counseling, a one-on-one. And then when I get there, they go, "Why are you here?" And I go, "Well, I'm here because my child's in counseling for self-esteem, and I want to know how can I be a better father? How can I create a space where we're developing in that, right?" And then that counselor can help me with that, and bam, right? That's beautiful. That brings everything together, right? It brings all the pieces together. Continuing on with the topic of how to help our child while they're in counseling, I want you to think about the core routines. That's sleep, that's food intake, that's exercise, that is the stability of the home environment, right? Those core areas, they go a long way. So you can help your child while they're in counseling by making sure that there is consistency to the home schedule as far as consistency with sleep. Waking up on time, going to sleep on time. You making sure that there's consistency with meals, right? Are we having breakfast, lunch, dinner? And then keeping an eye on those. Making sure there's consistency with fitness, right? We're getting into our push-ups, into our movement, doing some yard work and so forth, right? There's great research that goes into we exercise, and then it has, not at the same level, but, close, strong effect, if you will, as medication. And then looking at the home environment. I don't know about you, but if I'm heading home, I want to head home to I know that we can't always get 100% peace, but I want to head home to a somewhat peaceful, calm, stable environment. So I share that with you because I want you to think about this topic that we're on here for the podcast. How do I help my child while they're in therapy? And you can help your child while they're in therapy by creating a home space that has stability, a home space where they feel welcome, they feel encouraged. Let's keep going. Last one here. How do I help my child while they're in therapy? And this one I'm going to give you because I think this one is one that sometimes I'll see, and often when I talk to parents about it, it's like, oh, I didn't know I was doing that. Right? I think it just takes a different perspective, or it's one of those where you don't see it because you're so into it, so you need like an outside perspective. And I think most of us, we have the humility, we're humble, we get it that we've been in situations where you just need someone really on the outside to poke it out and go, oh, that's taking place. So how to help your child when they're in therapy? Keep an eye on the wording that you use, excuse me. And in particular to these examples. Are you better yet? Right. So that one, it insinuates that if I'm the child hearing it, I wasn't better already, right? There was something wrong with me. Keep an eye out on things like, well, this is why you have to go to therapy. Right? You're isolating the child. You have to go to therapy. You're judging the child as if therapy is punishment or this thing that's bad or wrong. Keep an eye out on it's not working. Right? Often that language has to do with things that we fix. Right? So if you're trying to put a screw in and you need a Phillips head but you're using a flat head, you may go, hey, it's not working. I'm using the wrong tool. But here we're talking about someone's life. Right? So we want to be careful with those type of words. And then I want you to keep digging. There's definitely more in there. But overall, what I want to encourage in you as a parent when your child is engaging in therapy or some later point in life when you're thinking about taking your child to therapy is the language that you utilize, how you choose to communicate with them. That will go a long, long way. And you know who can help you with that? Of course, you're going to think that I'm going to say a counselor, which yes, a counselor can help you with that, but also your child. Right? If my son goes to counseling and comes back home, I could sit down and say, hey, I need your help, buddy. You're working with a counselor, Miss Sarah, and I want to know how can I be a good dad for you during this? How can I help you during this? He may go, well, what are you talking about? I don't know what you're talking about, Dad. And I can say, well, let's just imagine that you're going to soccer practice And I know you're going to soccer practice because you want to, be like Messi out there and get your skills up. And you love it, and you're growing and you're enjoying it. All those awesome reasons. So then when you come home, I want to figure out as a dad, how can I show up for you? How can I be a good dad in soccer and those type of things? Just like, your coach there. And then maybe he'll say, well, let's go outside and practice soccer instead of talking about it, right? And I say, great, you just taught me how to show up for you, right? You just gave me some leadership there. And I want to do the same thing here with the counseling, right? A little conversation like that, you shift the words around, that can really go a long way. Now, my hope today, as you're listening to the episode, is that, of course, you found it helpful. You found it helpful. That's always important. I also hope that maybe you feel a little more comfortable with the idea of working with a counselor, whether it's for your child, working with a counselor for yourself. I had recently talked to a colleague, and then I'll share this and stop talking. I think sometimes we look at other services very differently. If you go to a leadership camp or a leadership mentor, sometimes that could be different. You go to an executive coach, sometimes that can feel different. If you hire a consultant, sometimes that can feel differently. And then I think there's a stigma often that comes with a counselor or a therapist or a psychologist, a mental health professional. And what I encourage you to look at those spaces you go into as watering your plant, right? And really all you're doing is you're just watering your plant with a different bucket. But water is still going to that very important plant, right? You're investing in yourself and with different methods and different ways. I hope that you found today's episode helpful. I hope that you are enjoying this podcast. I hope that you are doing well in life, and that our doors here at Santos Counseling are open if we can be of support. Whether it's because you're at a really tough spot in life, or maybe you have an idea of a goal you want to achieve or an objective you want to address. We will help as much as we can, and if for some reason we're stuck and we're not able to help, we'll do our best to lead you in the right direction. I encourage you to share this podcast, share this episode perhaps if you found it helpful with a person in your life that you think would enjoy the listen. Take care. Sending you hugs. And if you're not a hugger, sending you a high five. And if you're not a high fiver, sending you a verbal message of I hope you have a great, great rest of the day.